We now know that both of the nurses who contracted Ebola inside Texas Health Presbyterian Hospital will continue their treatments at other high-level facilities.
Nina Pham, otherwise known as Nurse Number 1, she will be coming to the National Institutes of Health, where we'll be supplying her with a state-of-the-art care in our high-level containment facilities.
That decision comes a day after the second nurse infected, Amber Vinson, was transferred to Emory University Hospital. Dallas County officials say the nurses were transferred in part because the hospital needs to be sure there is room for others who may test positive. Hazmat teams at Vinson's Dallas apartment today started phase 2 of the decontamination process, while in Ohio, where she traveled before being diagnosed, others who may have had contact with her are self-quarantined.
This is a scary disease. So I think that there is some overreaction. And again, we're taking steps to try to decrease people's fears, certainly not to increase anxiety.
For the first time this morning, a nurse from Texas Presbyterian Health spoke publicly about her anxiety over what she calls a lack of protocol.
We never had a discussion. They gave us an optional seminar to go to, just informational, not hands-on. And it wasn't even suggested that we go.
Nurse Brianna Aguirre says nurses lack proper training and full protective gear, that lab samples were mishandled, and that staff moved in and out of the isolation unit and treated other patients without being properly decontaminated. She's one of 75 healthcare workers now self-monitoring.
Knowing what I know, I would try anything and everything to refuse to go there to be treated. I would feel at risk by going there. If I don't actually have Ebola, I may contract it there.
During a hearing on Capitol Hill today, officials defended the hospital's treatment procedures, saying they followed guidelines from the Centers for Disease Control, but acknowledged there was a flaw.
It's clear there was an exposure somewhere, sometime, and we are poring over records and observations and doing all we can to find the answers.
And stop the spread of the deadly virus.